Let's talk today about HIPAA and HIPAA violations, and I'm going to read you a couple of articles that are coming out of the American Dental Association News back in October 2020. And first, let's settle on what HIPAA means. It means Health Insurance Portability, HIP, and Accountability, Act, A. So it's HIPAA, HIPAA, Privacy and Security Rules. These are set out by the U.S. Department of Health and Human Services, and the violation that cost an insurance company $6.85 million to settle was between the Office for Civil Rights and, which is a federal, they paid the federal government basically, and the company is Perio Blue Cross. I would strongly doubt that anyone in Texas has this, although you never know. But it operates in Washington State and Alaska. It is the largest health plan in the Pacific Northwest. It's also agreed to implement corrective actions that includes 2 years of monitoring to settle this HIPAA violation. So let me give you the background on this. It affected more than 10.4 million people. Perio Blue Cross had filed a breach report on March 17, 2015, on behalf of its network of affiliates, stating that cyber attackers had gained unauthorized access to its information technology system. The hackers used a phishing email, spelled phishing. I know a lot of you computer savvy people know what a phishing email is. It is essentially set up that if you clicked on it, it then installs malware onto your computer. So somebody within this insurance company clicked on a phishing email that gave the hackers access to the insurer's IT system in May 2014, which went undetected for nearly 9 months and resulted in the disclosure of more than 10.4 million individuals' protected health information, including their names, addresses, dates of birth, email addresses, social security numbers, bank account information, and health plan clinical information. According to HHS, the Office of Civil Rights investigation found systemic non-compliance with the HIPAA rules, including failure to conduct an enterprise-wide risk analysis and failures to implement risk management and audit controls. Now, bringing this down to the personal level, we have to go through HIPAA reviews on an annual basis, and a lot of this is set up with our providers, with insurance companies. So the settlement represents the second largest payment to resolve a HIPAA investigation in OCR history. All right, the next article is entitled Arizona Healthcare Provider Settles HIPAA Rights of Action Violation. And I'm reading this one to you because I want you to know what your rights are under HIPAA for access to your own medical records. The Office for Civil Rights at U.S. Department of Health and Human Services announced October 7 it settled a case involving an Arizona healthcare provider's potential violation of the Health Insurance Portability and Accountability Act Rights of Access Initiative. Dignity Health, which operates at St. Joseph's Hospital and Medical Center in Phoenix, Arizona, has agreed to take corrective actions and pay $160,000 to settle the potential violation, according to HHS. The HIPAA Right of Access Initiative, created in 2019, supports individuals' right to timely access to their health records at a reasonable cost under the HIPAA privacy rule. The settlement, OCR, has announced a total of 9 enforcement actions under the HIPAA Right of Access Initiative so far this year, stems from an April 25, 2018 complaint the Office for Civil Rights received from a mother who said she sought a copy of her son's medical records as his personal representative. The mother alleged that beginning in January 2018, she made multiple requests to the medical center, according to the HHS news release. However, despite multiple follow-up requests in March, April, and May 2018, the medical center did not provide all of the requested records. The Office of Civil Rights investigation determined that the medical center's actions were a potential violation of the HIPAA privacy rule right of access requirement. More than 22 months after her initial request, according to HHS, the mother received the requested medical records on December 19, 2019. Now, this is an article and it doesn't give all the details of this poor mother and her son as to what the medical problems are, but we can imagine that there are medical conditions that need to be addressed, and their medical records, especially of a child, should be able to be accessed and moved to other healthcare providers quickly for the benefit and the health and safety of the child. So this to me is an important ruling in favor of the mother and the son that I completely agree with. Quote, "It shouldn't take a federal investigation to secure access to patient medical records, but too often that's what it takes when healthcare providers don't take their HIPAA obligations seriously," said OCR Director Roger Severino in a news release. OCR has many right of access investigations open across the country and will continue to vigorously enforce this right to better empower patients. As part of the settlement, St. Joseph's Hospital and Medical Center agreed to undertake a corrective action plan that includes 2 years of monitoring. I think the takeaway on this is that we as patients, and I count myself as a patient, have rights under HIPAA for our own records, and that they should be released to us upon request. There may be a minor administrative cost to this, but it shouldn't be an extraordinary expense. And one way to know that is if the expense is so much that they're really trying to inhibit us from access to our records, then I would consider that a violation. So, anyway, thought I would share that with you for today. Have a great one. Bye. This has been the Perio Patient Podcast, episode number 47. I am Dr. Ben Young, a practicing periodontist in San Antonio, Texas, producing this for my patients and anybody else who cares to listen. And this episode, I guess we'll give it some title that includes the word HIPAA in it. All right, have a good one. The fattest knight at King Arthur's round table was Circumference. Now go floss.